As the respiratory disturbances are concerned, I told you that we have to study about three important diseases. One is known as the hypoxia. Then another one is the hypercapnia and also asphyxia. These are the three different diseases situations which we have to study. Now first we will understand what is hypoxia. Hypo means always low and oxia means oxygen. So simply, in a very simple sentence, hypoxia means low oxygen, or is a condition where tissues are deprived of adequate oxygen. In the cells and also in the tissues, they are not getting enough amount of oxygen, or they are facing a situation of very low oxygen, leading to impaired. Impaired means damaged functioning. So that is what is the definition of hypoxia, and in several situations hypoxia can take place. Here you can see that one situation is when we are going to high altitude. For example, if you are going to Munnar area, or you are climbing Anamudi mountains, after some time many of you may feel quite tired because our body is not used to such high altitude. Or if you go to Everest or such regions, there the oxygen concentration will be very low in the atmosphere. So what will be happening is that our body or our lungs won't be able to get sufficient quantity or sufficient volume of oxygen, and there will be a shortage of oxygen from the lungs to different parts of the body, and that will lead to a situation where the cells as well as tissues will be experiencing very low oxygen content. So a lower oxygen pressure in the air leads to reduced oxygen availability. So there is one situation where hypoxia can take place. Another situation is some kind of lung disease, especially emphysema or chronic bronchitis. Here may be a picture of emphysema. Emphysema is actually a very damaging lung disease. Here you can see that the tissues of the lungs will be mostly, here you can see how emphysema will be affected. This is how the normal lungs will be there. This is how the nature of alveoli. Now in an emphysema, the alveoli will be somewhat damaged. Here also you can see that. So this is the normal way and this is the damaged alveoli. So that is what is happening in this emphysema. Then another situation is the bronchitis. Bronchitis simply means an inflammation of the bronchus. That is what we know by the name bronchitis. You can see that bronchitis means this is what is happening in a bronchitis. See, this is how the normal bronchus will be there. In a bronchitis, this wall will be like this. There will be narrowing of the wall, and as a result the person may not be able to breathe properly. So that is what is happening in the case of bronchitis. Then another situation of hypoxia is carbon monoxide poisoning, about which we will be studying, because carbon monoxide has a higher attraction or higher affinity for hemoglobin. So when carbon monoxide is present in the air, instead of binding with the oxygen, hemoglobin will be binding or attaching with the carbon monoxide, so that hemoglobin may be transporting more carbon monoxide rather than any oxygen. So that is what is happening in this carbon monoxide poisoning. Then we have anemia. Anemia means low hemoglobin level. So sometimes we should have a hemoglobin level of around 13 to 15 or 16. But if hemoglobin level is going below 10 or 8 or 5, that means our body doesn't have enough RBC or enough hemoglobin to carry this oxygen to different cells and tissue. That situation will also lead to low oxygen or oxygen pressure. So these are the four situations which are leading to hypoxia. Now what are the effects of hypoxia? Basically it will be causing breathlessness, cyanosis. Cyanosis means the skin become blue, and lips, and because there is oxygen deficiency in your body, and that will be also impairing or damaging the functioning of your brain, and there can be organ damage. So different organs of your body, if they are not receiving adequate amount of oxygen, they will be stop working, and that is known as a organ damage. And prolonged hypoxia can result in coma. Coma, unconsciousness. That is known as a coma. And if the person is not getting oxygen for a long time, that will be resulting in the death of the person. So how the body will be responding? Normally when we are going to a high altitude, we will be breathing more faster. So in case of any oxygen deficiency, our breathing rate will be increased. That is hyperventilation. Increased breathing rate, and heart will be working more faster, so that whatever blood is there, heart tries to pump at a faster rate, and increase the RBC production. That is another mechanism by which a body is trying to. For example, if you go to Munnar area and staying there for 6 months, and you are checking your RBC, you can see that there is a slight increase in the number of RBC. That is body's attempt to manage high altitude air or high altitude atmospheric oxygen concentration. Because by increasing the number of RBC, the extra RBC will be able to carry more or extra oxygen. That is a purpose of increased RBC count. So this is the idea regarding the different mechanism by which body is coping it. Now we go to the second type, that is hypercapnia. Hyper means more, capnia means referring to carbon dioxide. So it's a condition of high carbon dioxide in the bloodstream, usually caused by inadequate respiration. So in our blood there is an excess amount of carbon dioxide. So carbon dioxide is not is only present in our body in a minor quantity or in a mild lower quantity. If there is an excess of carbon dioxide in your blood, that will be causing a lot of problem. And before that, let's understand what are the causes of hyperventilation or excess carbon dioxide. Hypoventilation means shallow or slow breathing. So instead of breathing at a normal rate, if you are breathing very slowly, as in the case of older age people or some people with some lung disorder, often due to lung disease like COPD or neuromuscular disease. COPD is a very dangerous disease. I will show you a picture of COPD. What is COPD? Because it is a very damaging disease. COPD. Here you can see that this is how the COPD will be happening. See, in the case of COPD, there will be damage. There will be damage to the lungs. See here also you can see that this is a COPD, chronic obstructive pulmonary disease. That is a full form of COPD. So in the case of COPD, this is this is the healthy bronchus and alveoli. And in the case of a COPD, there will be internal damage to the lungs. So that is what is happening in the case of COPD. Then another situation is the neuromuscular disorder can also lead to hypoventilation. The person may not be able to breathe at a normal rate. Then another situation other than hypoventilation is obstructive sleep apnea. Intermittent pauses in breathing. There is some people will have that situation. So during the time of sleep, they may not be aware that they are not breathing for some time. So if the person is not breathing, even during sleep you will be breathing. But if instead of breathing continuously, if you stop breathing for a few seconds or a few minutes, that situation is known as obstructive sleep apnea. In some people such situation happens. Then respiratory failure. Lungs cannot exchange gas effectively. So normally the lungs and bloods are exchanging the carbon dioxide and oxygen. If something is happening in the alveolar region and if something is damaging, then if excess fluid is there, then there will not be any proper exchange of oxygen and carbon dioxide. Now let's see what are the effects of hypercapnia. As I told you, hypercapnia means increased carbon dioxide content and mostly due to inadequate respiration. So coming to the effects of hypercapnia, the symptoms mainly include confusion, headache, shortness of breath, and in severe cases panic attack, seizure. Seizure means fix something like, then loss of consciousness. So these are some of the situations where some of the symptoms that can be occurring as a result of this hypercapnia. So hypercapnia can do respiratory acidosis because in the case of hypercapnia there is extra amount of carbon dioxide. That carbon dioxide can combine with the water forming carbonic acid. And carbonic acid is an acid and that can lower the pH or increase the acidic content of your body. So that is why acidic blood pH or acidosis may begin happening in the case of extra amount of carbon dioxide. Now let's see how the body is reacting. What is body's response? Body attempts to eliminate excess carbon dioxide by increasing the breathing rate. So that is the primary, that is the initial response of the body. Instead of breathing normally, the body may try to breathe more faster so that this extra carbon dioxide may be eliminated from your body. And if this compensatory mechanism fails, blood pH drops. As I told you, amount of carbon dioxide, if it is increasing, carbon dioxide combines with the water forming carbonic acid. That is an acid and that will be reducing the pH, leading to acidosis. So these are the situations of hypercapnia. Now we go to the third situation, that is asphyxia. Now coming to asphyxia, A means absent. So there is almost complete absence of oxygen. So it's a life-threatening condition where body is deprived of oxygen, leading to suffocation. So suffocation is one important problem. That is, for example, somebody is holding your on neck and you are not able to breathe properly. That will be leading to asphyxia. Asphyxia means almost complete absence of oxygen. So physical blockage. For example, choking on food or foreign objects. If some foreign particle is entering your pharynx and blocking your trachea or air tube, then you may not be able to take sufficient quantity of oxygen into the lungs. So that is another physical blockage or choking of food or foreign objects. Then drowning. When you are in water, you may not be able to breathe because we don't have the capability of taking oxygen from water. So that will be leading to and that is a drowning. So water blocks the air entry into the lungs. So that is what is happening when you are in the water. Then strangulation, physical constriction in neck prevents airflow. So strangulation means if somebody is somebody is holding your neck or some kind of other situation also can lead to strangulation. Then exposure to toxic gases. Breathing in gases like carbon monoxide or cyanide, because these gases one is cyanide can immediately damage your most of the cell. Carbon monoxide can combine with hemoglobin and reducing the affinity of hemoglobin for oxygen. So these are the situations that lead to asphyxia. So in the case of asphyxia, what we are seeing is that almost complete absence of oxygen. Now what are the effects of asphyxia? Initial symptoms on gasping, the person tried to breathe faster, or gasping for air, panic and cyanosis. Cyanosis, you see the blue coloration, the lips, eyes, etc. And followed by unconsciousness. The person become unconscious. There will be fix or seizure. Then brain damage there, and death may occur if oxygen supply is not restored. So this is the effect of asphyxia. Then so out of the three important disorder, one is hypoxia, second one is hypercapnia, third one is asphyxia. Now we'll see another situation that is known as a carbon monoxide poisoning. So as I told you in the earlier situation, what is a because carbon monoxide has a comparatively higher attraction for hemoglobin. So in presence of carbon monoxide, hemoglobin always bind with the carbon monoxide. See, carbon monoxide binds with the hemoglobin 240 times more strongly than oxygen. So that is the reason why carbon monoxide can act as a poison, forming carboxyhemoglobin. See here you can see that, and which is significantly reduce oxygen carrying capacity of the blood. So in order to carry this oxygen, hemoglobin should combine with oxygen, forming oxyhemoglobin. But here what is happening is that in presence of carbon monoxide, hemoglobin will be combining with the carbon monoxide, and which has around 240 times more stronger attraction. Then What are the sources that can lead to this carbon monoxide? Inhalation of carbon monoxide from faulty gas heater. That is, in our area, gas heaters are not popular. But in European countries, we go to Canada or such area, during the winter time we have to turn on the heater. And sometimes in many houses, heaters are working using gas, and if the and gas can lead to the form and the gas leakage, and sometimes can produce a lot of carbon monoxide. Carbon monoxide, does it have any smell or other thing? Without certain equipment, we cannot detect the presence of carbon monoxide. And car as exhaust fumes, that will be containing carbon monoxide. House fire, then also improperly ventilated combustion appliances. If there is some heating situation in our fireplace in your house, especially in colder countries, such situations are such equipments are there, that will be also creating a lot of carbon monoxide. Problem with the carbon monoxide is that we need an extra equipment to detect it. We cannot tell it by color or smell or by feel. So industrial accidents involving exposure to carbon dioxide is there. And what are the physiological effects of carbon monoxide poisoning? Coming to the physiological effects, symptoms range from mild headache, dizziness, nausea, confusion, weakness, blurred vision and unconsciousness. These are some of the important effects of carbon monoxide poisoning. Then high level, if the amount of carbon monoxide is very high, that can lead to seizure, fixes. Then heart arrhythmia, the heart may not be beating properly due to lack of oxygen. So how can we treat this carbon monoxide poisoning? Usually what we do is that we will be supplying 100% pure oxygen. So immediate removal of carbon monoxide sources and giving the patient 100% pure oxygen is the method by which we are treating this carbon monoxide poisoning. And in severe cases, hyperbaric oxygen therapy, pressurized oxygen chamber is used to rapidly remove carbon dioxide from the hemoglobin. So that is if carbon monoxide poisoning is happening, what we can do is that give the person 100% pure oxygen, especially in a highly pressurized way, so that there will be faster removal of carbon monoxide from the hemoglobin. So this is what is happening in this carbon monoxide poisoning. Then we have one more topic, that is the physiological effects of smoking. So now smoking, everybody know it can cause a lot of damage to lungs and also to most of the organs in your body. So smoking introduces numerous harmful substances into our body, impacting the physiological systems, especially your respiratory system and cardiovascular system. These are the two primary systems which are damaged by the smoking. See, smoking contains nicotine. So what is the effect of nicotine? Nicotine stimulates the release of adrenaline, increasing your heart rate and blood pressure. So that is the primary effect of that. The smoking, the cigarettes will be mainly formed of tobacco. Tobacco contains nicotine, and nicotine stimulates your adrenaline, increasing heart rate and blood pressure. Then nicotine constricts blood vessels, reducing blood flow to vital organs and peripheral tissue. That is another effect of nicotine. Chronic exposure leads to addiction and withdrawal of symptoms, making quitting very difficult. So this is the most of the physiological effects of smoking is actually caused by two components. One is nicotine and second one is the tar. I will show you a picture of how this smoking can damage the person. See, a lot of damage, almost most of the organs of your body. This is a pure picture of how this is a normal lungs, and this is how lungs of a person who is smoking regularly will be here. This is also this another picture. So that will give you an idea of how the lungs will turn into if you are smoking for several days. Here also you can see that. So this is what is happening during the sleep, and this is also the other some of other effects of smoking. See, the gums may be damaged. So a lot of complications are there for smoking, not only to the lungs and also to many other parts of your body. Then tar is there. The tar consists of toxic chemical that damage lung tissue, and it adheres with the lung surface and paralyzes area, which are responsible for clearing mucus and debris from. That is, because when you are smoking, along with the smoke, small amount of tar. Tar means the same tar that is used for road repair. That tar will be present. That tar will be giving a coating inside your lungs, and that will be blocking the functioning of this mucus, so that the tar will be accumulating. That is why gradually that black color formation is taking place. This leads to mucus buildup, chronic inflammation, contributes to chronic obstructive pulmonary disease. Earlier I told you about a disease known as COPD. COPD is a very damaging disease, and also chronic bronchitis and emphysema. So these are mainly the physiological effects, and most of them are caused by the presence of tar in the smoke. Then carbon monoxide will be also present. So reduce the oxygen carrying capacity of the blood by binding with hemoglobin. So along with because smoke always contains little bit of carbon monoxide. So when you are smoking, along with the nicotine tar, you are also inhaling carbon monoxide. Carbon monoxide can combine with hemoglobin, thereby reducing the oxygen carrying capacity of the hemoglobin, making heart work harder to supply oxygen to the body. Over a time, this results in damage to the cardiovascular system and increasing the risk of heart disease and stroke. So that is the problem of the smoking, that not only affect lungs, it also affect your heart, and also it can also affect the brain by causing stroke. So these are some of the problems of smoking. Then coming to the long-term effect. In the case of long-term effect, smoking is a major risk factor for lung cancer, with around 85% of lung cancer linked to smoking. So normally lung cancer is very rare. Only people with smoking, this type of cancer known as lung cancer develop. Most of the cancers are affecting stomach or other parts of the body, but lung cancer is one type of cancer that is almost exclusively or completely caused by smoking. Then chronic respiratory disease like COPD, that earlier I told you, is a progressively worsening, leading to reduced lung capacity, difficulty in breathing, and also premature death. So COPD is chronic obstructive pulmonary disorder. So smoking can also lead to COPD. Smoking also affects your reproductive health. That is another thing most people don't know. Smoking can also damage your reproductive system, reducing fertility in both men and women, and causes complication during pregnancy, low birth weight, and developmental issues in the fetus. So smoking can affect your lungs, your heart, your brain, your reproductive system also, and increase the risk of cardiovascular system, including coronary artery disease, strokes, and peripheral artery disease. So these are some of the complications of the smoking. So smoking is something that can affect almost every part of your body. So mostly lungs, heart, brain, and reproductive system. So this is an idea regarding what are the effects of smoking and why you should not go for smoking, because it can damage your lungs, it can reduce your lifespan, and not only the lifespan of the person who is smoking, also the family members. So, and most of the time those people who are having who are practicing smoking usually have developed some kind of cancer. You know if somebody in your house is having a cancer or a very damaging disease, how much money you have to spend on that. Most of the time this person may not have saved enough, and whatever income that family may be having, he will also spoil that, and finally he will die. And this is what is happening in most of the family. When a person is having cancer, that the person may die after some time, and with the death, the family will also go into some kind of debt. So this is what is happening in most of the families in Kerala. People never bothered about taking life insurance, medical insurance, Then when something is happening, we go around and begging. This is what is happening with most of the families in Kerala. So this is an idea regarding what are the physiological effects of smoking. That is one topic. Another is carbon monoxide poisoning, and third one is the respiratory disturbances. So this is an idea regarding all these topics.